Welcome to the Echo and Encourage podcast. I'm your host, Hannah Abbott, and I'm honored to have you here. This is the place where we talk about things that echo eternity and encourage everyone. Whether you're looking for powerful strategies to grow on your personal journey or the best tips to flourish in every area of your life, you're in the right spot. Let's dive into today's episode. Welcome to the Echo and Encourage podcast. I'm your host, Hannah Abbott, your encourager to live your best life. Today, we are welcoming back Dr. Linda Jackson, a psychiatric nurse practitioner and educator. Check out her wisdom in a previous episode called Balancing Mental Health and Faith with Dr. Linda Jackson. Thank you so much for joining us again today. It is an honor to have you.
Thank you. I'm glad to have you too. Thank you.
You're welcome. Thank you so much. I thought that today we might dive into the topic of ADHD, attention deficit hyperactivity disorder. Would you please share with us what is ADHD? What are maybe the causes or signs and symptoms that people might not know about?
Okay, ADHD is a neurodevelopmental disorder. It's not necessarily a mental illness like some people can confuse it. And I know that when people think that I'm not going to take medication because it seems like I'm sick or I have mental illness. ADHD is not categorized under mental illness as you would have anxiety and depression and schizophrenia that are actually mental illness. ADHD is not one of them. It is a neurodevelopmental problem that comes during the brain formation, and things didn't go as it was supposed to, and it affects some functional capabilities of the individual. In order for them to function in terms of, mostly I would say the executive function may not be really at par as it's supposed to be working. So don't be afraid. It's not a mental illness in the first place. So don't be shy or ashamed of taking medication if it comes to that. So ADHD is, like I already said it before, it impacts people's ability to function, to complete their tasks. It impacts attention. So there are two parts. One is attention deficit, which usually it was known to be ADD. And another one is a hyperactive type, the impulsivity type, which some people will say, they are restless, they are all over the place. And it happens from childhood. At least it could be diagnosed before age 12. You can see some children, school age, toddlers, you notice something different, restlessness, bouncing off the wall, interrupting people, interrupting adults. And again, for between children and adults, there are similarities, and of course there could be differences too. But it affects all ages, it affects all genders, and it can really disrupt. It can disrupt one's activity. It could disrupt one's, relationship, job, project, school. Even within that person, they can still feel they're not connecting with themselves, meaning they are like restless, unable to focus. So it's internal, and it could also affect internally and externally. So it's somewhat an overburdening or overwhelming condition.
Thank you for sharing that. What would you say is maybe the reason why there's more and more women, at least, well, my personal experience getting diagnosed as an adult later in life with this, and other women that may have seemed to slip through the cracks as a young person, but later in life they're finding the diagnosis?
Yeah, sometimes, most probably people are, they have that symptom growing up. One, when they are younger, possibly parents noticed that this kid, man, something is a little off here, but they are not trying to admit to that. They allow the kid to go. They're not trying to seek for help. They're trying to be in denial that their kid is fine,
Mm,
even though they know that the kid's behavior and cognition and activity is abnormal.
mhm,
So they put it behind, and they, until when the kid starts to disturb so much in school, then the school will force the parents to look for answers. Then they do. Sometimes when kids get diagnosed, yet parents may not, they'll still be in denial, and they may not want to move on to, seek help for the kid. And of course, the kid will struggle through elementary school, middle school, high school, because they cannot initiate their own treatment, or seek for their own help. Then they, until they become an adult, 18 years and up, then they start looking for their own answers.
mm.
So that is when, at that point, they are skipped from being diagnosed when they were younger, even though they carry that symptoms from childhood, struggling all the way up until when they are a little, of age to seek for their own help. And that is why. So when they become adults, some will take it upon themselves to seek for help and stop struggling. Then some would still, carry that denial that their parents put in them, that this could be it, this could be how life should be, this could be a normal life for me. And they will not seek for help.
Mm.
So you mean people falling through the cracks? Yeah, they know something is hard for them. Life is really hard versus the regular person, but they don't know that they have to seek for help. They think it's a normal life until way older. Now it started to affect the family. It started to affect their job. They are losing job. They are getting queries. They are getting write-ups. They are getting warnings, and they become afraid, and they will begin to find help. So otherwise, things will fall apart. Therefore, that's when we catch them in the when they are already old or older, and they say yes, we put them through this screening test, and here it is, they have it, and they've gone through hard times in school, in relationship, in their job places, for something that they would have sought for help long ago.
That makes sense. When I hear about ADHD, I often think about, the children that have a lot of energy or off the walls. Would you speak a little bit about the other parts of this disorder where maybe they're not hyperactive, but they still have this attention deficit disorder and what that might look
Yeah,
like?
you've already spoken is at inattentiveness,
Mhm.
attention deficit. So they are not remembering, they forget, they read and they reread. They read one sentence 5 times. They read, they don't retain. They forget easily. They forget their keys, where they've kept their keys. They forget to turn in their homework. They forget that they have homework. They forget that they have projects. They start off project and they forget about it. So it's inattentiveness. When you're talking to them directly, it's not penetrating. It goes this way, like from one ear to the other. We always say, why I talk to you, you listen, it goes from one ear to and off the other. It's inattentiveness. It's not the adult's fault. It's not the child's fault. He pays attention, but their mind constantly, they can't grasp it. So when you're talking to them directly, they are saying, okay, yes, okay. And then they can't make out anything you've just said. Ask them about what you said in the next 5 minutes, they don't know.
Mm-hmm.
So it's inattentiveness. It makes it hard for them. It makes people with that condition, children with that condition, even adults, they don't perform optimally to their capability, to what they can't perform, they can't produce much. So they're always, and of course, you know what? It triggers fear, it triggers worry, it triggers anxiety
Mm-hmm.
because they can't even defend their project. When there is a general meeting, they are panicking because they don't know what anyone is talking about. The entire meeting of 1 hour or 2 hours will go by. They are there, but they can't remember anything that was said of that meeting. And guess what? They go behind and say, hey, what did they say? What did they say? What did they say we should do? What did they say we should do? Sorry, it's not that. They try to focus. They lack the focus.
Mm-hmm.
They bring them every little thing, they get distracted.
Yes.
Every little thing, even the noise, even the animal going by, even the cars going by, even somebody coughs, everything, any little thing snaps the attention from them.
I know you mentioned this is a neurological disorder. Is that correct?
Developmental, yes.
Is developmental. Is this something that you're only born with, or can it also be something that you get maybe from trauma or something else?
Well, no, it's not, it has not been connected with trauma. Okay, it's not been connected with trauma because it's like a neurodevelopmental thing. It's there, but as people grow, they try to cope with it. They
Mm-hmm.
try to, it wears different outfits each level of human development, from children to teenagers to people try to find a way to augment, to cope, so that the impact of that condition wouldn't cause so much havoc in their lives. So yeah, it's not part that was connected with trauma events in one's life.
So you were born with it, just like people are born with autism spectrum disorder. It's something neurological. So that is interesting. I'm thinking about some of my clients that they have ADHD and autism spectrum disorder. And so, what are some of the other things that you're seeing with people who have ADHD? Are you also seeing autism or other things, or just mostly ADHD only clients?
Well, there is a concurrent diagnosis or comorbidities that come with that sometimes.
Mm-hmm.
Majority of the times, or more than half of the time, individuals are just solo diagnosed. They are just having the ADHD or inattentive type. But a lot of times you find out that somebody who has ADHD may also have anxiety,
Mm-hmm.
may also have depression. And some of the clients will say, I don't have anxiety, it's my ADHD that induces my anxiety. And that will also be true because when they are not able to accomplish their tasks and they are now meeting up their deadlines, whether at work or whether in school, they jitter, they become nervous, and a prolonged stressful condition that goes into nervousness, that goes into anxiety. Will trigger anxiety at the end of the day. Why? Because they procrastinate and procrastinate, they're not able to deliver. So when they're not able to deliver their tasks in timely manner, now look at them. They are restless, they are sad, they are depressed, they are unhappy, they shiver and shake. And some of these things are what we see, the symptoms we see in anxiety and depression.
That is such a wonderful insight because when somebody understands what is the root problem that needs to be addressed, it sounds like their anxiety and depression could drastically go down if the ADHD component was treated properly, and one would help the others significantly.
Yeah. And also, if I may add here that we who are the practitioners, we like to rule out anxiety as the cause of lack of focus, because anxiety and depression, one of the symptoms of these conditions are lack of concentration, lack of focus, because everything about ADHD, inattentiveness or hyperactivity, when they are all over the place and restless and pacing and jumping and they are ruminating, restless thoughts, racing thoughts, they're not going to concentrate on anything. So now we're going to want to make sure that this is not the lack of concentration and lack of focus and all that is not because of anxiety and
Mhm.
depression. So we will always ask, have you had diagnosis of anxiety? Have you had diagnosis of depression? If
Mhm.
it is no, we will also go ahead and screen for that. So we screen it and we find out that it's negative, and then we will say, okay, this is just organic ADHD right
Mhm.
from the start. So we will now start treating. So yeah, we want to make sure that it's not ADHD is not induced by one of other comorbidities.
Who tests for ADHD and what are those tests like?
We test practitioners, MD psychiatrists, psychologists, um, nurse practitioners, PMHNP nurse practitioners. Yeah, so far them.
Mhm.
Okay, but every other aspects of the clinic, the clinicians also treat. So now there are multiple ways, about possibly three ways to treat this. One, therapy. Therapy, everybody everybody will jump in. When I say everybody, will be like the social workers with master's degrees, clinical social workers or clinical psychologists, uh, psychiatrists, MDs, and psychiatric nurse practitioners and advanced nurse practitioners. All these practitioners or therapies can treat using therapy. Now, when it comes to medication treatment or pharmacological treatment, the people that are licensed will be the people that will treat, like the MD, psychiatrist, and the nurse practitioners, psychiatrist, psychiatry nurse practitioners are the people who will treat using medication for the condition. Yeah.
And when somebody wants to get a test from you, how extensive is the testing? Is it pretty much a checklist where you go over if you have something, or is it a long test?
Well, there are short testings. All these are standardized testings, and there are long versions of these testings too. For us, we make it short. We use the short version of testing. Whereas if you go to psychologists, they use a longer version of testing for this, for this kind of situation where they go through every detail. They do every component of those question items. They go in depth. So it could run in days and weeks before could diagnose the patient.
Mm.
Okay, but for us, there is another quick one. We just use a quick one the because they came to you, and you have to diagnose with the psychological screening tools that is standardized, of course, to before you to get your diagnosis before you jump into any type of treatment that the patient deserves or that the patient agrees to. Because it's good that it's one thing that you diagnose and the patient agrees with to the diagnosis, and it's another thing for them to have the treatment options, treatment plans. The options that you will give them, they have to be the one to choose. Meaning, would you want to treat this condition using therapy only, or would you want to use medication? And if
Mhm.
you want to use medication, there are two types of medication. One will be stimulant and one will be non-stimulant. So stimulant and non-stimulant, you have to explain to the patient what these are, and then give them that option to make a choice. And their choice will be where you're going to focus your treatment plan and give more resources and direct them in the right to the right course. Yeah.
Yes. For the counseling option, what are some of the maybe strategies that might be implemented in a counseling session? Would it be things to help with their overall organization or maybe like their mindset about
Yes.
having this?
So, so well, it depends on the individual where they are having the hard time. Is it the procrastination? Is it the, like you said, the organizing their tasks? Is it that they are not able to, follow up with appointments, follow up with their tasks, creating multiple tasks and not finishing any or jumping? So it depends on the hardship that they have that they want to focus on, because therapy is patient centered. It's not about what we'll generally know about how to proceed. It's just what is hard for you right now. What are you having difficulty right now? So what do you need help with right now? So we jump on that, and that will make so much meaning, and the patient will benefit, because otherwise you're leaving whatever is that is the problem, or giving them their solution and jumping off to something that is irrelevant, that's not impacting them right now. So they have to choose the where you will start. Okay. So whatever they bring to the table, you try to help them with that immediately, so they will feel the impact and they will start feeling having the relief.
Yes.
Mhm.
And then when it comes to, well, I'll share a little bit of my journey. I had a wonderful counselor, social worker figure out once during a session that I have ADHD, and I remember I was just frantically in the car logging into my session, holding all of my private practice, speech therapy, home health files and trying to get set up. And she brought it up and I said, "Oh, nobody's ever really told me that." So she did the questionnaire, talked to me about it, and I shared it with my family. And then I thought, okay, I'll try the whole counseling approach. And I thought I won't go into medicine just yet. It was a very long time with the counseling approach. And while there were so many breakthroughs in counseling that really helped me to really get in a safe place and flourish, I realized I needed to try some medication. So I ended up going to a psychiatrist, and they started me on something, and I remember having the mindset of, telling people I have ADHD. Oh, but I'm not on a stimulant. And I kind of thought if I had to try a stimulant, there might be shame attached to that. And I'm not sure where that's coming from, where I was thinking one was maybe better than the other. And then over time, it still wasn't supporting me in the way that I needed to function. And recently, I was prescribed stimulants and I am functioning so well. I'm thinking clearly at work. I'm not having to pray that hyperfocus kicks in so that I can write my reports clearly. And so I'm wondering, have you come across people that have shame attached to either starting medication or starting stimulants? And where would that be coming from? And how can we debunk that it's not shameful to need support?
All right. I appreciate your storyline. Yeah. Thank you for sharing.
Yes.
It's very unfortunate that so many people struggle on the face of things that can bring them solution. So many people struggle without knowing. It could be shame, it could be ignorance, it could be naivety. It could be some people will say they have faith in God, and they have faith in God. God will heal them or has healed them. That is all very good. It's all very good. I Where the shame is coming from is thinking that I'm well, I'm healthy, nothing, I don't have any disease or sickness. You believe that. Everybody believes that. But then when the body starts to fail, you start to still say, I'm healthy. No, this is not happening to me. The shame, the denial. And then once the hardship is too much that you can't really function, and the individual decide to go seek for help, and then they already made up their mind, I'm not doing any medicine. But even though you look at the screening, you find out that they are severely impacted, or they are severely impacted by the condition. And according to the way we are trained to treat, when there is severity of a condition, it needs attention, whether it's psychological or whether it's medical. It needs attention. It needs intervention. Maybe more than one intervention will be needed for such a severity. And then you say, you're grinding, you're struggling. Would you like to be like this in the next 5 years? And they are scared. They say, no. You've done therapy. It hasn't really helped, or it has helped to a moderate degree, but it hasn't really answered your question. I mean, answered your problem to the full, that you can function optimally. What do you want to do? Do you want to add another treatment plan in order to augment with the therapy to help you? All these questions you ask them so they can gain insight into themselves. And once they get insight into themselves, they will be making the decision, because they will say, oh no, I don't want to be like this tomorrow. I can't be like this tomorrow. You've tried therapy for 6 months, for 9 months, for 2 years. It hasn't really cut it all for you. Does it mean that it's something now you can add to it in order to help you better, to get a different desirable outcome? What about low dose of medication? What about this? What about that? And then you give them options and you leave it to them to go home and think about it. If
Mhm.
they still say they don't want a medication, you're happy with it. You keep going with them. If they
Mhm.
say they want to try something different to possibly get a different outcome, then you work with them. But again, in everything, it's going to be educational. You always educate them. You always say that your idea, your decision is welcomed. Your decision is beautiful, and I will support it. I'm going to start you on non-stimulant. Then we explain. Non-stimulant is, it helps to increase your attention span. It helps to kind of control the rumination, the thought, the racing thoughts. It helps to calm you down. It helps to clear your mind so you can be focused. It helps you to, with the skills of therapy, to take up your task one after one at a time and finish it, and not to, be hyperactive and not able to accomplish anything. And you tell them about that, tell them about the side effects, the possible side effects of non-stimulant, and also the greater possible side effects of stimulant, the difference. So that by the time you open up and explain both, and they will make up their mind where they want to start, and giving them low dose is where we start for safety. In case if there's going to be any side effect, it's going to be minimal. It's not going to be such that you that will really hamper on you. So we start very slow, very low, and very slow, and see how your body takes it as we move forward. That these medications take time. So if you say that where the thoughts are coming from, that this particular medication helps you more than this particular medication, and we're all going to always tell them to be patient with the treatment, because nobody off the far of the nobody of the start knows what your body type can take. So we start with this. Maybe one medication is not good for you, then we try another one, and then possibly most majority of the time it will be good for you. So yeah, if you talk about this, non-stimulant is slow acting. It builds up in your system for a period of time, possibly over many days, over weeks, before it gets you to a level where you will be happy with your performance. And also, the stimulant itself is fast acting, like in hours, in minutes to hours. You notice that, you notice the difference. You notice your concentration, just like you said when you gave us your own, out of your own experience, what between non-stimulant and stimulant, which one helped you speedily and which one gave you the best desirable outcome. Yes, stimulant is good. It does well and gives you quick response, and you notice it. But of course, don't we are not going to not be aware of the side effects of long-term use of stimulant, just like every other controlled substance. We're always going to tell our patient, yes, this is helping. Sometimes we ask you to go on medication holiday when you are on controlled substances, in order to break the cycle of addiction that such controlled substances can bring, now or in the future. So, little bit of taking breaks here and there. Some people take stimulant Monday to Friday and give themselves 2 days to to kind of get it off their system, and then Monday again they begin. Sometimes they take all through, and once one day are on vacation, they stop. Either way, little things you can do to kind of cut down the addiction of that medication building up strongly in your system, in your brain, will be an ideal thing. So
Mm-hmm.
I'll ask people if you don't have a busy day, heavy day, maybe give yourself a break of one day or two. It's going to be helpful. And when people are taking stimulant, there are other things that come with it. We will have you test for. We'll have you sign a substance no, not substance. We have you sign the stimulant contract. We tell you all that you need to know in that contract so you're able to know that this can be addictive too. So you watch out for yourself. You sign the contract, you do urine drug screening oftentimes, and you do lab work oftentimes, and you do EKG oftentimes because stimulant can impact the heart
Mm-hmm.
in a way that is undesirable. And we have to be using EKG to monitor that your heart is still in good condition to continue with the medication. Otherwise, to some people, it could cause some heart condition or develop some heart condition that is not okay.
Mm-hmm.
Then we have to really stop.
Thank you for sharing this. Dr. Jackson, what would you say? I've heard just different things online. I've been trying to look into this topic. I've heard some people say that, for example, the stimulant Adderall um, could be addictive, like that you're saying. I've heard some people say that if you truly need it, that it's not addictive. What are you seeing clinically? Are you seeing patients start to have addictions to stimulants, or are you more reading about it in research articles, or both?
Well, it is. That is why it is a controlled substance because it has addictive tendencies. Addiction, addictive tendencies of stimulant does not mean it goes to the same degree with everyone. Everybody have their own level of tolerability, of addictability that uh, that is possibly designed for them. So if genetically people they come from addictive family that use substance, family that they have a addiction of alcoholism, or drugs, street drug use, all types of things, like all types of behavior addictions, is genetic to such person, that they have that his root or his genetics have addiction or high risks of addiction there. So that person's addiction to stimulant will be high.
Mm,
It will be high because he has the gene already. But if it is somebody whose genetics or family genes don't have addiction issues, it will be less. It might not be such that will be alarming or will be a threat.
mm-hmm,
So the thing is, when people have such addictions running in the family, stimulant will also enhance that addiction, will
mm,
increase that addiction to the stimulant and to other drugs. So we will say you just have to watch yourself, even though we know this is very helpful, but you just have to still know that you have more things you are at more risk
mm-hmm.
than people who don't have genetic addiction in their families.
So, for someone who has a genetic predisposition to addiction, they also have ADHD and stimulants is helping them. Is that, um, do the benefits outweigh the potential harmful effects by still trying it out and maintaining a routine appointment with the care doctor to check in? Or is it something that is contraindicated?
Well, it's not contraindicated because your family has a high addiction disposition. No, because it is individual, it's
Mm,
individual based. The only way we don't really advise it or want to push it is if that person is actively using drugs.
mm,
If someone is actively using street drugs, we cannot. It's not good medical practice to support and continue to increase that high risk of addiction in them, knowing that stimulant will reinforce that addiction.
mm.
So we don't do that. But if you come from a family that have that and you're not participating, you're not doing those drugs or those things, we just treat you the way you are because we know your path is different and you have your own purpose. You have your own things to fulfill. We support you. We help you if stimulant is the way to go. We will
Yeah.
say, but you know what? You just have to know your family history, family background, and then watch out for this. In case
Mhm.
this is beginning to happen, then you have to pull out.
That makes sense. Thank you. I love how you're able to see each person individually, understand their complex backgrounds, and then deduce information from that. One question that popped up in my brain was, what would you say to someone who used to do street drugs and now they realize they have ADHD, but they are not wanting to try medication? Would you say they'd be a good candidate to try some sort of ADHD medication if their life is really impacted by their ADHD? Or because of the history of street drugs, is it not something that they should try?
Thank you. So they can be treated. Everybody has the equal opportunity to be treated, to be helped, whether they are drug addicts or whether they are not. Everybody has the opportunity to get help.
Mhm.
Therefore, yes, we will treat them. They
Yes.
are treatable. What it means is that we're not giving them stimulant.
Mm,
We will use non-stimulant and we will explain why. Okay. If they agree with the treatment plan, because we don't want to reinforce that addiction they have already, and they agree after educating them and explaining that to them, non-stimulant will help them too, because non-stimulant has been designed to also treat ADD, ADHD. Therefore, it's the same thing. The thing is, we're not trying to do anything to deepen you or make you worse in that addiction process. We're not going to contribute to that.
mhm.
So we will only treat you with non-stimulant or possible some one type of medication that is under antidepressant category.
Mm.
We can use that too.
I love how there's hope for everyone. And I know, at least in mainstream media or seeing some movies, you sometimes see in a medical scene somebody say, "No, I won't take the medication because of my history to addiction." And so I was wondering if some people might think, "Oh, I don't qualify for ADHD medication because of my history of addiction." So I think you debunked that right there, which is
Yeah.
really helpful. And I was wondering, what do you say about this? I know we talked about it in our other episode together a little bit, but I've come across many people who love God, many people who say that they have faith that He'll heal them or that life is good just how it is, but their ADHD is affecting their relationships with others. People in their lives plead with them to get medical help, but they hold on to faith. And it's almost like, in my opinion, it's almost like I'm not sure if I should say this because I'm just having no filter, but kind of like making it a lowercase God, a lowercase God of like, no, I don't need anything but the our heavenly God. And it's like they're holding on to that so tightly that they're not able to see the big picture of what our heavenly God can give them to not only live life to the fullest, but also the people that are in their inner circle will be able to be cared for in ways that they've been craving for so long. So what would you say to the person that not only for them, but also to kind of open up their perspective about how it's affecting their loved ones?
Um, I would say, we appreciate the the love you have, the faith you have for God, the trust you have for God for your healing. We appreciate that, and and also, and for the fact that you also acknowledge that this condition is impacting your life, your relationship, is also something that needs to be balanced. If if you come to acknowledging, first of all, is to acknowledge. If you come to acknowledge that you have this condition, and this condition is making your relationship almost intolerable, it's no longer moving smoothly like it's supposed to move because of things, you're not holding up your end because of your condition. So, what do you think your God will want you to do to take care of the family and the relationship He has given you? Would your God want you to continue to struggle and continue to make everybody uncomfortable, unhappy, the way you're not holding your own end? You're not holding up your end with God, with your family. Do you think God will be proud of you when you do that? You make everybody go through hardship because you refuse to take help. So that question is to you. And I'll say, it does not. Remember also that it is the same God that gave us the practitioners, the brain, to go through this training for you. Remember, it's the same God that made the scientists learn how to put medications together to help you. Otherwise, He would take the knowledge away from us. Okay? So remember, when there is healing, it comes from God. And that healing can also come from God through medication. The healing will come from God through therapy or using therapies. We're all doing the same. Have you ever thought about, I am comfortable. I'm comfortable going to the doctor, medical doctor, to get checked, to do my labs, to do my yearly routine checks, my assessments, my physical. You don't have, and then the doctor say, let's do more screening, go to get x-ray. And then you're rushing, you go and get x-ray. In those times, you don't feel any guilt. And you think that it's God helping them, but you don't feel any guilt to get lab work. You don't feel any guilt to get x-rays. And the doctor said, I'm going to refer you to another doctor, cardiologist, so that they can look more into your heart. You don't feel any guilt going to another doctor, from one doctor to another. When it comes to prescription, the cardiologist will say, take aspirin, 81 milligram daily with food. Otherwise, you have clogged arteries. You have clogged arteries, and you may be high risk for stroke. And then you take the medication every night, even if it means the rest of your life. Why? Because you want to live longer. And then I say, what's the difference here? Whereby you go to these medical things and have no guilt. And then we say, come to psychiatry for evaluation, for emotional evaluation, neurological evaluation. Then you feeling guilty. Then you feel sad. Then you feel you're gonna dictate to say no. Is this not the same body of yours that you're gonna take care of? The spirit, the mind, and the soul. Why would you take care of one part of your body, physical body? Your ankle aches, you go put bandage on. I mean, you go put something to tie it up. Where you have headache, you take Tylenol. You don't feel guilty. But then we say, go and evaluate, help yourself with emotional, do emotional evaluation and see that your mind and your psychology, everything is still good. Emotional assessment. And then you say, no, I'm not crazy. It's not about that. You're not crazy, but you're just going to do whatever you do to A, you do for B.
Mm-hmm.
Whatever you do to Tom, you do, say what you do for the goose, you do for the gander, right? So if you take care of your physical body, why won't you take care of your emotional body?
Mm-hmm.
Why do you feel sad? Or why do you regret? The doctor will say, take eyeglass prescription. Go to the doctor, the optometrist, give you glass because you need to enhance your vision. And that's medication too. And
Mm-hmm.
that does not bother you. That you go and get that. You wear it because you want to see well to drive. You wear your glasses because you want to read, but you don't feel guilty there. But you feel guilty that you're told to take this for that, to do this emotion that will support your emotional being. But remember, if your emotion is not taken care of, if your psychological part of your body, life is not taken care of, it's going to tear down your physical body.
Mm.
Whatever that goes on in here will come out.
Wow.
When you have stress on taking care of, when you have long duration of stress, one long duration of anxiety or suppressing, long duration of ADHD or something that you're putting, sitting on because you want to feel well, not taking care of those areas, sooner or later, it will begin to break down the building blocks of your immunity inside you, and your physical body will go down. So go seek for help. When you go seek for help, you have options for treatment. Remember, treatment is not only medication. Treatment is not only medication. Treatment is also talk therapy. These things help. And you could have one treatment model or two treatment modality in order for you to feel whole.
Mm. That is powerful. You are so wise, and I am so blessed to hear you speak, and I'm so excited for our listeners to get to really hear you and think about what you've said, the appeal that you've made. I think that you're breaking chains by what you're speaking about and the truth that you're showing. And I think that it's going to transform lives when they listen and they do go seek help, and the transformation that comes from really being able to think clearly.
Mm,
And I just know in my own life there's been so many wonderful benefits that have come through the talk therapy and the different levels of medication help, whether it's in decluttering. This week I've donated so many carloads of things to places. I sold a carload of things, decluttering the space, being able to stay on top of work tasks and life, actually doing the dishes every day and not feeling like you got to let it all pile up and FaceTime somebody to make yourself do it. Like there's this independence that comes when you're treated, when you have that correct treatment plan going for you. And I know there's different stages in one's life where you may need one treatment plan or the over the other.
Yeah.
And so it's just so freeing to be able to be in your own body and to be able to function in a way that you're able to flourish and not feel like everything is way harder than it should be. So, from my own experience, I say yes to what Dr. Jackson has said. Doctor, how can people, our listeners, get in touch with you?
Well, I have my clinic. I can, I'll give you the number.
Yes.
There we talk, we cancel, and then we do medication management. All about it is your own welfare, your own comfort level in treatment. Myself and my office and my staff, we don't push you to do anything. We give you the options and we encourage you and we recommend. At this time, you have severity of depression or anxiety, or you have the severity of ADHD, you need medication support because of the severity, because you can't function, because you can't do all that you want to do, because you keep aborting tasks upon tasks, starting one, not finishing, feeling overwhelmed and restless thoughts and all that. We'll say at this level, given the screening we've done, the score shows severity, you need a supplemental plan, or you need a double plan or double intervention. But if you have mild, possible moderate condition, we will say just try more things before going to the medication. Try therapy, try other techniques, other skills. We give you skills, some other treatment options beside medication to see how that helps in a short period of time. And
Mhm.
after which we can go ahead and reevaluate. So my office number is, if you have it, or else I'll give it to you, 909-521-1585.
What
That is
is
Sapphire Psychiatric Medical Group.
very
Sapphire Psychiatric Medical Group. And we have two locations. Excuse me, we have location in Cerritos and we have location in San Bernardino. We do therapy, we do telehealth, I want to say. Telehealth, um, and then we can see patients if they want, and we can schedule for that. Otherwise, you want us to see you very quickly, then we do therapy within, we schedule you for telehealth, video call within 24, 48 hours, thereabout.
and this is California. And are you licensed right now in any other states or only California?
Only California, but I'm working on Nevada. Nevada is almost
Ooh,
rounded. So any minute from now, they will call me and give me the license. I already done everything they want me to do, so waiting on them.
congratulations. This is wonderful for you and anybody in Nevada. Dr. Jackson, what's one way we can echo eternity or encourage others?
I will say, go have discussion, go talk to somebody, come to us, and we will bring the peace that you need. We will help. Okay? You cannot ignore or neglect your emotional body. You got to. If you go to yearly physical assessment, please come to us so we can also help you assess your emotion. to make sure that you're balanced and you're living a wholesome life.
Mm,
And then you can be happy from now onward.
it's
Thank you.
beautiful. Thank you so much for sharing that. Did I miss anything? Did you have anything else you wanted to share for this episode?
I think we are good so far. Thank you.
We did it.
Thanks to the listeners. Thanks to my viewers. I appreciate your time sitting here listening. I hope that we have touched you or answered your question. Otherwise, you can also email my host, Miss Anna Abbott, and she will bring your question to me on the next episode.
Yes. Send
Thank
in
you.
your questions, your comments. Dr. Jackson has so much wisdom, as you can tell, and she's so willing to share and to help educate our community. So thank you, Dr. Jackson, for your time, your expertise, and your ministry. I appreciate you so much, and it's been an honor to have you again. Thanks so much
Thank you
for
so much.
listening.
Thank you for the time. See you next time.
See you next time. Thanks so much for joining me today on the Echo and Encourage podcast. I hope this inspired you and gave you a fresh perspective. If you loved today's episode, hit that subscribe button, rate, and leave a review. Your support helps this encourage more people. Connect with us on social media or visit our website for more resources to help you live your best life. See you next time.